Courtney. I'll be your student nurse today. Can you please state your name and date of birth? Alrighty, Edith Jacobson. Perfect. And are you allergic to anything? No. Alrighty, and are you in any pain? Alright, so we're at about a 4 for pain. I'm gonna set you up right here. And we're gonna be administering meds today, okay? To help you feel a little better. Okay. Alrighty, so I'm gonna go ahead and call your doctor just to verify some meds, okay? Alrighty, so ring, 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 and then hi. I am calling regarding Edith Jacobson, an 85-year-old hip fracture pre-op patient in room 101 in the STEM Center. She admitted to falling and fracturing her hip the night before she was admitted to the ER, and she's scheduled for surgery tomorrow. Do you know who I'm talking about? Okay, perfect. So I just wanted to verify some meds with you. So she's pre-op, and you ordered 30 milligrams, and the recommended dose for a pre-op patient is 40 milligrams. Did you want to go ahead and change that? And then he said yes, so we're going to change it. And so we changed enoxaparin sub-Q 40 milligrams every 12 hours until surgery tomorrow evening. Is that correct? Perfect. And then you also ordered morphine sulfate IM 5 milligrams PRN. I just wanted to verify how often you wanted to give that. That's not specified. Recommended is every 4 to 8 hours for pain. So he wanted to change it to every 6 to 8 hours for pain. So for correction, you ordered morphine sulfate IM 5 milligrams PRN every 6 to 8 hours. Is that correct? Awesome. And then I also wanted to verify route for morphine. Since Ms. Jacobson is receiving sub-Q enoxaparin, I wanted to recommend changing that route from IM to sub-Q to prevent hematoma. Would that be something that would be okay? And he said it was okay to change it to sub-Q. So we changed morphine sulfate to sub-Q 5 milligrams PRNs every 6 to 8 hours. Is that correct? Okay, perfect. So I appreciate it, and I will call you if I need you. Thank you. Alrighty, so I have all of my doctor's orders now. So I am going to start. I'm going to go ahead and give my oral med first, just because it's the easiest. So my oral med is the hydrochlorothiazide. So I'm going to do 3 checks. So I did my first check at the Pyxis when I got it out, my second check up to the MAR, and I'm doing my 3rd check right now with the patient at the bedside. So I would scan the patient's armband, scan it into the computer, and verify that it's hydrochlorothiazide. So we're administering 12.5 milligrams right before breakfast. So prior to giving this med, I'm going to assess the blood pressure, and if it's the systolic is below 100, I'm going to hold and call the doctor. I want to go ahead and get a baseline blood pressure. I want to make sure that her I's and O's are good. I want to correct any electrolyte imbalance that she might have prior to giving this, potassium specific, and then making sure she's not dehydrated. I want to check cap refill and turgor, and then also want to get a baseline weight for her. So I have my med. I'm going to teach about this med, making sure, so Ms. Jacobson, we want to make sure we're not drinking alcohol, operating heavy machinery, anything like that while you're taking this. And so I got my baseline blood pressure. I want to make sure that I have that in all my charting, because this can cause an orthostatic hypotensive effect. And we make sure we're not eating licorice, okay? Alright, so we're going to take this in the morning, and then I also want to ask you if you've eaten today. But we are eating breakfast right now, so that's perfect. And so we want to take this in the morning to prevent nocturia and to minimize GI upset. This drug can cause a potassium deficit, so we want to make sure we're eating some potassium-rich foods like bananas. If you have any muscle weakness or cramps, please let me know. And if you need to sit up or get on the side of the bed or something, just do it slowly. This can cause some posture, and your posture changes can cause you to be dizzy. Let me know if you need help getting out of bed. Just hit your call button and I'll come in here and help you. And then also, if we're going outside for a long time, we want to make sure we put on some sunscreen or a hat to cover your skin. And for administration, I'm going to set the patient up. In like high fellowship to prevent aspiration. I'm going to supply a cup of water with a straw just to help the patient get the med down. And then I'm going to give this, watch them take it, and then document. So for reassessment, I'm going to make sure I'm assessing her eyes and O's. Making sure she's going to the bathroom. Checking for dehydration, blood pressure, weight. I'm going to monitor her signs for potassium deficit or hypokalemia, which would be shown by muscle cramps or weakness. And then I'm going to monitor liver and kidney disease as well. Alrighty, and our next med, we're going to give enoxaparin. So we're giving enoxaparin to prevent her blood clots or pulmonary embolism or DVT after her surgery, which she's scheduled for tomorrow. So the doctor ordered 40 milligrams sub-Q, which when I did dose calc came out to 0.4 milliliters. And then we're going to do sub-Q. So we're going to do it in a fatty part of the abdomen. So when giving this injection, like multiple times, I would just change sites, and I don't want to give more than 1 milliliter per site. So prior to this, I'm going to assess for bleeding. So this is a blood thinner, so we want to make sure the patient's not already bleeding. I might check around their gums just to get a baseline bleeding factor. Also want to draw blood to establish that clotting factor to assess the platelet level. And then ask Ms. Jacobson if she's allergic to pork, which she is not. So I'm going to administer blood pressure, and I am going to assess the blood pressure and assess the heart rate. So since Ms. Jacobson is an elderly patient, I'm going to administer this medication all the time with caution, just due to the fluid volume deficit or hypokalemia effect. So, we pause it. Alrighty, so I'm going to administer this injection laying down. I'm going to clean the vial. I'm also going to clean the skin, inner to outer. I'm also going to tell the patient that I am administering this drug on the right side of her abdomen. That way she can just kind of have that in her mind, so at her next administration she could tell whoever that she got it on her right, but it would be in her charting as well. So I'm going to give it deep sub-Q in the abdomen. And doctor orders 0.4 milliliters. .4 milliliters. Alrighty. And and with the bevel up at a 45-degree angle. I'm going to pinch the skin on the abdomen and give me a stick. And 1, 2, 3, stick. This medicine can burn, so I'm going to tell the patient this could burn. I'm going to administer that. And just because that squirts out, I touched it. I wouldn't touch it after. And then I'm going to safety cap this. Alrighty. And no more than 1 milliliter per sub-Q injection site. Alright, Ms. Jacobson, and we just want you to notify us if you start having abnormal bruising, bleeding, fever, or swelling. And then let us know before you start taking any over-the-counter meds such as aspirin, okay, for pain. And let us know if you have any muscle weakness. And then after I administer the meds, every 4 hours I'm going to assess for bleeding, bruising, her temperature, and then maybe like the day after I'm going to start measuring her weight again. And I'm going to monitor her hemoglobin and platelet count along with her blood pressure. Alrighty, and now we're going to administer your pain med. So doctor ordered morphine sulfate, sub-Q 5 milligrams every 6 to 8 hours as needed.
Hello?
Okay.
Hi there, this is I'm calling about your medication.
Alrighty. So prior to giving morphine, I'm going to assess the respirations. If they're below 12, I am not going to administer. And making sure the heart rate is between 60 and 110. Her pain level's at a 4, so that's moderate pain, which is okay for this medication. And then ask if she has any history of sleep apnea, snoring, or addiction. And then I want to administer with caution regarding, or just keeping in mind that this can cause respiratory depression and constipation. So we want to make sure that there's a stool softener ordered for her, and then also want to assess her bowel sounds prior to, just to make sure I've got a baseline bowel assessment. So for sub-Q, I'm going to be using a 27 gauge 1/2 inch needle, and I'm going to do it on the left side of the abdomen, which is different from my sub-Q injection, no more than 1 mil. And then, so Ms. Jacobson, I just wanted to let you know that this medicine can cause lightheadedness, nausea, anxiety, constipation, and difficulty breathing. So if those do occur, please let me know. Try to take some deep breaths, cough, turn, and use your incentive spirometer, and use your call button if you need to get out of bed, and I'll be more than happy to come help you. Make sure you're not taking this with alcohol, and avoid using heavy machinery or driving. This can cause nausea, vomiting, dry mouth, excessive gas, and abdominal pain. So just let me know again if you have any of those. Okay. Clean the vial. Okay, and clean the skin, inner to outer. And we're administering on the left side of the abdominal wall now. And we are administering 0.5. Alright, and that's a 0.5. So, going to administer this on the left side of the abdomen, pinching the skin at a 45-degree angle. And a stick, 1, 2, 3 stick. This could burn, but we're going to try to make this as quick as possible. And we're gonna cap this. Safely cap. Alrighty. So I'm gonna reassess after giving that the vitals, respiratory rate, monitoring it specifically right after, making sure it's not below 12, making sure I'm monitoring her level of sedation, and then I also want to tell her to be cautious of using St. John's wort. It can have contraindications with morphine. So, alrighty, Miss Jacobson. And just make sure you use your call light if you need to get up, okay? And I'll come help you, okay? Alrighty. Have a good day.